Hermione and Madame Pomfrey came around the curtain. Madame Pomfrey was holding a large bottle of something labeled Skele-Gro. "You're in for a rough night," she said, pouring out a steaming beakerful and handing it to him. "Regrowing bones is a nasty business." So was taking the Skele-Gro. It burned Harry's mouth and throat as it went down, making him cough and sputter. Hello, everyone. My name's Ian, a Muggle physician working in Canada. Here at Media Medicine, we break down the real medicine in movies, books, games, and any other media source your doctor prescribes. Today, we'll be looking at the real medical principles behind Skele-Gro from the Harry Potter series. Now, in the book, a rogue bludger happens to smash into Harry's elbow, and in the books it says he can feel his elbow break. So the diagnosis is what we call an olecranon fracture, or an elbow bone break. This injury is actually pretty common, seen in the ER. What comes to mind would be skiing accidents, motorcycle accidents. I can even remember a case where it was a breakdancing accident. But essentially, Professor Lockhart, who is not a doctor, by the way, decides to complicate the diagnosis by removing most of Harry's bones in that arm. In the book, it's described as a sensation starting from the shoulder and spreading down to the fingertips. So we'll just upgrade that diagnosis to phocomilia. Phocomilia is a rare condition. It's called a congenital condition where it occurs at birth, where you have underdeveloped limbs. Now that could be an arm, that could be a leg, but certainly it is possible, and it's a real life condition. Now that we have our diagnosis, let's focus on the medicine used, Skele-Gro. Does it have a real life equivalent? The short answer is absolutely. You might be thinking of something like 3D printed arm bones, or maybe something similar to what Mad-Eye Moody is rocking. But in the books, it's an actual medicine that Harry drinks. It's got a real burning taste going down, and as Madame Pomfrey so elegantly puts it, growing bones is a nasty business, and yeah, it really hurt Harry all throughout the night. Now, while not as extreme as Harry's case, in the real world our bones can break down slowly over time, or thin out, if you will. This condition is called osteoporosis. While osteoporosis can happen at any age, it's generally seen in older people. Sometimes when our bones get so thin, they can break under their own weight, or even with very mild force. So forget about a bludger hurling at Harry's elbow for a minute. I bet somewhere a poor retiree with osteoporosis has broken their elbow before from a stray wiffle ball. I've seen some cases even worse than that, where one of my patients was getting up from a couch and her spine just gave out. Now, the medication we use to treat osteoporosis is called a bisphosphonate. There are many medications in the bisphosphonate family, actually, but they're remarkably similar to Skele-Gro. You cannot grow a brand new olecranon or any other bone from scratch for that matter with bisphosphonates, but they do help your existing bones grow and get denser. This in turn prevents fractures like that wiffle ball incident I mentioned previously. The other big difference is that strengthening of these bones typically take years with bisphosphonates, not overnight like Harry's case. Now, this is where the differences end and the similarities begin. The most common side effect of bisphosphonates is that it can cause inflammation in your throat as well as your stomach. This occurs so often, actually, that doctors will warn their patients, don't lay down after you take a bisphosphonate, or else the stomach acid will actually go back to your throat and burn you even more. The arm pain that Harry feels throughout the entire process is also very accurate. One of the other common side effects of bisphosphonates is that it'll cause bone pain and joint pain as you take it. In extreme cases, the medication can actually break your bones. That's right, you heard it correctly. The medication that's supposed to help you prevent bone breaks can break your bones very rarely. I know this seems like a pretty raw deal, taking this muggle Skele-Gro, which can burn my throat, hurt my joints, but take years to work instead of overnight. At the end of the day, however, a doctor would only prescribe this treatment if the benefits outweigh the risks. Bisphosphonates have saved countless people from life-threatening or even life-ending fractures. It's also been used to fight some forms of cancers, especially the ones that have reached the bone. Muggle doctors are just like Madame Pomfrey. They'll talk to you about the medication, warn you about the side effects, and only treat you when necessary. Again, I really don't know where Lockhart got his medical degree from. Probably Durmstrang or one of those correspondence courses Filch takes. Well, thank you for watching the first episode of Media Medicine. I'm Ian. If there are any other medical questions you have after consuming some media that you would like answered, comment below.